Clinicians who rely on clinical assessment only might miss important information from brain imaging, and I want to give you an example with a case study. This is a case that spans 3 continents. A clinician from the US who contacted me here in Australia to consult on their father who was in a 3rd continent. The father had meningitis and was treated for it in a hospital for 3 weeks and then was discharged home. They were getting better, but after a few days they started deteriorating. And this went on for a couple of weeks until the family felt that they really needed some answers from the treating team. The treating team said that this deterioration is due to the meningitis, but the family felt that something was missing. Hence they contacted me. When I looked at the brain images, I could see that except for the meningitis, something else was going on. There was something that looked like hydrocephalus, some people pronounce it as hydrocephalus, which is buildup of fluid in the brain that causes pressure, increased pressure on the brain. This could explain the deterioration that this person was experiencing. Therefore, my advice was 1, to seek a second opinion from a radiologist about whether hydrocephalus is going on or not, and 2, to start talking with the treating team about the possibility of inserting a shunt, which is a device that drains the excess fluid from the brain. This is an image showing the 2 most common shunts used for draining hydrocephalus, and you can find more useful information about hydrocephalus and shunts on the website of the Hydrocephalus Association. It took months for the family to advocate for a shunt, and once the shunt was inserted, the father started getting better again. The takeaway from this case is that clinical assessment alone is not enough. The patient was deteriorating, and it was not possible to determine by clinical assessment whether it was due to the meningitis or due to something else. But the brain images showed that there was hydrocephalus going on as well. It is important that you make sure that the treating team is looking at the brain images and that they're looking at the brain images from a rehab lens. And the way to do it is by asking the team to explain the lesion on the brain scan and why it might be causing the symptoms that it does. In this case, you could ask questions like, if the meningitis is not worse, why is the patient getting worse? The bottom line is that you need to look at brain images to make sure that important information is not missed. If you like this video, please like, subscribe and share, and head to my website for more useful videos.